This is Carol from the STS. This is the Adult Cardiac User Group call for September 15th. Thank you everybody for joining. Be sure to put your questions into the Q&A and we will get started here now. Almost got the Bob Marley song again. Okay, we have a nice audience today of 281 people and 9 panelists. On the line with me from STS, we have Jane Hahn, Leanne Jones, Emily Conrad, Catherine Holyfield, and Sydney Clinton, as well as Melinda Offer. And then from IQVIA, we have Jean and Joe. So thanks everybody for joining. Quick STS updates. I don't have a whole lot today, so if we don't have a lot of questions, we may end early. IQVIA updates and then user feedback. So if you need to submit a question to us regarding a status update with IQVIA, please be sure to include your ticket number. You could use the raise hand function if you'd like to be unmuted or submit using the Q&A question. So here are some important dates for adult cardiac. Today is our user group call. Tomorrow from 2 to 4 p.m. Central Time is our new data managers webinar. If you're able to join this webinar, I highly recommend it. Melinda will be providing a good overview of the database and all of the resources and answering some questions regarding data abstraction, nothing clinical, but functionality. And for new data managers, I think it's really important to join. For more seasoned data managers, it might be just a nice refresher. So we have the monthly webinar is scheduled for October 6th. I put tentative here because I got summoned for jury duty and I might be at jury duty on October 6th. So if I'm not available, we won't be able to have our webinar on that date, and I'll make sure I communicate that out to everybody. And my jury duty will last over AQO. So hopefully I want to be picked, but hopefully if they don't pick me, that would be okay too. So I could be at AQO this year. Otherwise, Melinda will be moderating the sessions. Melinda and I were going to moderate together. Melinda might be flying solo for AQO. And then the same thing with the user group call. They said jury duty, it's federal, so it might last, they said it would last 4 to 6 weeks. So might be out for a little bit. And then November 12th is the Harvest 4 close for adult cardiac. And that will include OR dates through September 30th. Okay, so there's that. And then just some quick STS updates. Don't forget to register for AQO if you haven't already. It is free for all data managers associated with an active participant. Oh, ignore my polling questions. I forgot to remove those from the last update. It is free for active data managers associated with an active participant. Right now, we have over 900 folks registered. This will be our largest AQO yet. So if you are able to join, a lot of great information. If you're not able to attend on the days that they're live, I suggest you still register so you can get the material, access the material afterwards. And then for those of you who've missed it on previous webinar, version upgrade for 2023 is on hold because of some changes, additional changes that are going on at STS. So it's on hold for 2023, and we'll discuss the future dates with the surgeon leadership in the coming months to come up with a plan for the next upgrade. So no changes happening. We're happy with version 4.20. There's some tiny things that could be updated, but nothing that makes the version antiquated. So we're still going to stick with version 4.20.2. And now I'm going to hand it over to Joe Brower. Joe?
Thank you, Carol. Good afternoon, everybody. No new updates today, but I will review the updates we discussed on the last call, starting with this first one here on the weekend of August 28th. We did an upgrade to the general IQVIA platform, and that upgrade should now make it so your uploader defaults to the case form selection. So you should no longer have to choose that from the dropdown. And that is in effect currently as of August 28th. As for known issues on the next slide, we do have a few items the participant dashboard report, STS 6485. Carol, can you go ahead and go to the next slide? Thank you very much. Where am I? We did receive some feedback regarding how the post-operative stroke data is displayed on the participant dashboard report, and we are looking into ways to reconcile the yes response from version 2.9 with the various yes responses from version 4.20.2. STS 6747, some percentages displayed on the report appear differently on the web page versus the same data when exported. And we do believe we have identified the cause for that, and we're just working to get a fix out to correct that for you. STS 7193, the total post-op ventilation hours is displaying as missing when the extubated in OR variable is answered as NA, and that should not calculate as missing for you. And then STS 7152, the dashboard does not display the counts for patients marked as expired in OR within the MT OpD plus died in hospital plus died in OR line on the dashboard report. On the risk adjusted report, STS 6785, the NQF outcomes measures are displayed as a percentage when they should be displaying as a ratio. So we are working to correct that. And STS 7183, the calculation for blood products used is incorrectly referencing the archived parent variable intra-op blood products refused. And so that will be corrected in an upcoming release. On the missing variable report, STS 6781, we are looking into reports that the NQF variables filter on the MVR is not correctly including the variables it should be. So we'll be reviewing that and make sure we get that updated to include all the correct variables. And then STS 6832, similar to 7193 above, the total post-op vent hours are showing up as missing on the MVR as well when the extubated in OR is answered NA. And STS 7194, the MVR is not flagging surgical site infection as missing like it should be.
Great, thanks, Joe.
Mm-hmm.
And it's still TBD for the release of these, right?
That is correct. Yep, we are working on them, but we don't have a release date assigned yet.
Okay, thank you.
Yep.
IQVIA support plan is here. No changes. And then a couple links and support phone number. And then we're going to go to open discussion. I don't have anything. I'm going to put this back on the dates slide. I don't have anything new for STS to talk about. The user group calls have been, previously we provided education on the user group calls, but really they're intended more for networking or sharing ideas among the participants. So happy to, any questions or if folks want to weigh in on any ideas they have, feel free to put it in the Q&A or raise your hand. I do want to correct myself. It seems that I was wrong that the song is not from Bob Marley, but it was from Bobby McFerrin. So I apologize for causing any confusion with that. Okay. Amy says, oh, I know what I wanted to show you all. Just for those of you who have not registered yet for AQO. If you go to the sts.org, if you go to the sts.org homepage and go to, you could either go to meetings or registries. I like to, let's try to be consistent and go under registries, STS National Database, and you scroll down a little bit here, you'll see the Advances in Quality and Outcomes of Data Managers meeting. That's also known as AQO. And this is where you'll be able to register, gives you more information on the agenda. And then you can add a calendar reminder for that. Adult cardiac will be on Thursday, October 14th. And then the agenda is here. It's going to start off with, we'll get to, so on Thursday, we have the general session, and then we'll have the adult cardiac session. And just to show you a list of things that are coming, we have quite a robust agenda. General update, this will be an update on just kind of the state of the adult cardiac registry. We're going to talk about new models, measures, and indicators, including the three-year CABG and the multi-procedural composite. and the status of the aorta risk models. This one I highly recommend you attend because it will provide great information from Dr. David Shahian and Dr. Nimesh Desai. Aorta cases, Melinda has been working very hard with a couple of these presenters on their presentations, and I think this aorta one will be a great one. Dorothy Latham poster presentation, improving engagement in the STS National Database. We'll be hearing from different sites about how they improved their data collection process by implementing a couple changes at their site and involving how they got their care team involved in their data collection process. Northwestern will be presenting in Baylor. From Texas will be Northwestern from Chicago and Baylor, along with Karen Kim from Michigan, Mike Bowdish from USC, and Dr. D'Agostino from Leahy, Glenn Whitman from Johns Hopkins. Finding your way through the Maze case scenario, internal mammary exclusion. I think this one will be very interesting to attend. Endocarditis, which is Melinda's having a near aneurysm, trying to help prepare for that one. And then we'll talk about the coding of cannulation and perfusion for the operative section, and then the what data managers want to know. The what data managers want to know session is going to be organized a little bit differently this year. Melinda has taken questions that came in and has prepared answers with the surgeons ahead of time. So we don't have a whole lot of back and forth and confusing discussion, just to make sure everybody's on the same page before presenting answers. All of these sessions will have open Q&A at the end. And then we'll have a large list, 4 different things here for the on-demand sessions, mitral valve. We'll talk about TVT star ratings with Dr. Desai for those sites. We have a large overlap for sites who abstract for TVT. So if you are registered, maybe somebody who is at your site that abstracts for TVT is not listed, you can definitely share this information with them. TAVR in the aortic valve universe from Dr. Bavaria will be a very fantastic, I guess. I don't know what else to say, but when we get into talking about the changes across aortic valve surgery since the start of TAVR, he'll be talking about that longitudinally. And then an update from the anesthesia section. And a little bit different for anesthesia. The last couple of years we've had anesthesia, we've talked about coding cases. This year we're going to talk about how the data is used. And so if you're interested in data and how we are doing different research projects within the registry specific to the anesthesia data that's being collected, I highly recommend that you attend this or watch this on-demand session. So again, to register, I'm just going to go back up here. To register, you just go to the homepage and you can register right here. And we will be offering CEs. I don't know that we don't have the values yet, but we'll be offering CEs for the courses as well. So now that I took my time going through that, I see we have some questions that came in. And let me see here. Okay. Sure. So Victoria is asking, she says, in the last webinar, you shared the email address for us to email our suggestions for the new version. Could you repeat it again? So we were having a version, at that time, we were planning a version upgrade for 2023. That work usually would start this summer, two summers before it would go live. However, STS senior leadership has postponed that version upgrade for 2023, either in the coming years following, maybe 2024. But if you do have a suggestion, you can email it to me at, you took my email address down. I'll put it in the chat box.
I put it in the chat box for you, Carol.
Oh, thanks, Leanne. So you could email me any suggestions you have, and I am saving them for when we do have an upgrade. Okay, next question. Will the STS, Jane, maybe, are you there? Maybe you want to take this one. Jane Han. Will STS benchmarks change from the isolated cabbage since we are moving to a 3-year reporting cycle?
Thanks, Carol. I can take this one. The 3-year reporting cycle or the 3-year time window only applies to the cabbage composite. So all other sections of the risk-adjusted report will remain 1 year. Only the cabbage composite section will be 3 years.
Great, thank you. Thanks, Jane Han. Next question. Hi, Carol. I sent a suggestion to IQVIA enhancements you requested have been logged under STS 3668 regarding the risk score report. We only have the option right now to pull the report by STS version. I suggest if it could be viewed by date of surgery by quarters in order to review the STS risk scores for specific periods of cases. Anyone think this could be important? Thank you. Yeah, I think that would be interesting to see how your risk of patients are changing both by year and by quarter versus the entire version. So I'm sure if you sent it in, Natalia, if you had sent it into IQVIA, we'll be reviewing it on an upcoming elaboration call with them. So that's a great idea. Thank you. And I'm going to have to check. I don't know. That might be something. I'll have to double check. I don't know. Maybe that will be something we can incorporate into the longitudinal reports as well. Emily Conrad, are you there? This one's for you.
Hi. Yeah,
hi.
The on-demand sessions will be available 1 week prior to the meeting. So we will open the virtual meeting platform 1 week prior. I think that's around like October 5th or 6th. Every attendee will get an email with the login information. As for on-demand sessions, those will be on there. And then for every session that's live, within 1 to 2 business days, if you missed one of those live sessions, it'll be available on the virtual meeting platform as well. So check back in a couple days after the live event and you'll be able to see those again.
Great, thanks. And Emily, one more question for you that's not here. As I know that some of us have uploaded resource documents for our presentations.
Yes.
When will those be available for sites for participants to review ahead of time?
Yes, those will also be available the week prior unless the information can't be shown until after the presentation. So most of them will be on there a week prior. All of them will be available directly after the meeting.
Wonderful. Thank you so much.
Yes.
Okay. 4 cases has missing value in COVID fields. Will they be included in star rating measure analysis? If you did not code that the patient as having a positive COVID PCR testing prior to surgery, then they will be included. So missing values equal no for those COVID fields. I'm struggling, but I highly recommend that you code those fields because we are auditing and we probably will audit again next year on the COVID field. So make sure that you go back and code those fields so you don't get a low audit score. I'm struggling with exporting the longitudinal reports from IQVIA. Can you review it again? I can do my best unless Joe, you wanted to take that one. I can try to do it. I have to log in. Hold on.
I don't know if I have a test site handy.
Okay, hold on one second. Yeah, I have one. Let me see if I can do it here. Okay. Oh, we're looking at the longitudinal report. So that was under operational reports, the longitudinal outcomes dashboard. I'm going to look at the most recent harvest, which is the default there. And it's going to take a second to load. Not too long. And I think probably the export report button is going to work. But let's see what happens here.
Should be that easy.
Yeah, I think so. And you should be able to select which ones you want. Joe, do you know if there's a way to export the whole? I guess it has to be per page because you have filters applied to each page, right?
Right.
Yeah. Okay. So
But yeah, the export report button should be the way to go.
Okay, I must not have any data in the test site, but yeah, I said I don't have a participant listed here, but it should be this export report button. We're gonna see what happens. I just did that, but we'll see what happens with it. It opened, oh, there you go. So it looks like it applies the filters across each page.
Yep, it does
should-
give you each page.
Yeah, it looks like it. And then you should be able just to do the export report button and it should download for you. I hope that is what you're looking for. Okay, will the IQVIA direct data entry be adding sequence numbers anytime in the future? It would make searching the training manual so much easier. I'm not sure exactly what's on the direct data entry, if it's just the short names. And I can tell you that if it's the short names, the reason why the sequence numbers aren't there, you can still search the training manual by short name. The reason the sequence numbers aren't there is because sequence numbers change across versions and the short names stay the same across versions as long as there isn't a major definitional change. So if you're opening the training manual, and I'm sure that you probably already know this, so I apologize to go through it, but if you're opening the training manual, you can do a Control F, and the print's gonna open small, I'm sure, but you can do a Control F or Edit Find, and then this box will pop up, and let's just say I want to look for the ejection fraction question. I could just type in the short name and it'll populate. I'm not sure if the short name is available, and if it's not, please let me know. We can talk with IQVIA about that. Is there an option in IQVIA to view provider level risk adjusted outcomes outside of the MIPS module? No. If you're looking, there is a surgeon specific report that your surgeon would need to consent to, and only the surgeon would have access to that outcomes report specific for their NPI. If you're looking for more information on that, you could email the STSDB at sts.org, and I'll put that in the chat box for you. And then I am confused by registering. I registered July 29th and I don't think the agenda was set yet. I just relogged on and I don't see an option to choose from agenda.
I think that if this is referring to AQO, the AQO registration is for all days this year, so you don't have to register for specifically adult cardiac or general thoracic, etc. You'll be able to get access to all of the content.
Wonderful. Thank you, Emily. So once they register, they're registered for everything, and then they can attend on the days or sessions that they want to attend on. Is that right?
Correct. And if you want to receive credit, the caveat is if you watch a general thoracic, you have to watch all of the content to receive that credit for general thoracic. You cannot just only, watch 1 or 2 sessions and get the credit for that. If you want to get credit, it has to be for the full day.
So yeah, so for CEs, you have to watch the entire session, all of the sessions.
Correct.
Okay.
Correct. So all adult cardiac, all general thoracic, exactly.
Okay.
Yep.
Yeah, thank you.
Yeah.
Okay. Heidi says there was some chatter about renewing surgeon contracts in the email group. Do we need to renew surgeon contracts? I didn't follow the whole thread, but saw some discussion regarding this. Jane Han, I'm going to hand that to you if you're there. But I can
am
tell
here.
you.
And,
oh, hi.
Oh, sure. Thank you. I don't think the chatter is accurate. I don't know how else to address it than this. If you have a new surgeon that is joining your PID, we do require the Schedule A form and submission of a participant contact form. But new contracts for surgeons, that does not seem to be accurate.
I haven't heard that anywhere. You would know. I think
I
we
would
all would
know.
know, but yeah, we haven't heard that. Sorry,
we would.
Heidi. Yeah, just the Schedule A if you're adding on a new surgeon. Thanks, Jane. MIPS is over. We're not doing MIPS for 2022. And Nancy says, so, I'm not sure why you are saying this, but so we no longer need to fill out the STS risk calculator. Oh, you're referring to that as part of MIPS? No, the STS risk calculator should still be filled out. It is part of one of the NQF measures, so it's helpful to have it filled out on all patients if you're collecting it. And let me see where it went. Oh, I thought it was here. Maybe we don't have it in an NQF measure. But we still want the STS risk calculator filled out. It engages, it's the patient surgeon engagement, and it's also part of shared decision making. So it's important, and we still highly recommend that you fill that out. There was discussion a while back about creating a hybrid longitudinal outcome dashboard with analyzed data and data upload between reporting periods. Has there been any progress with this? No, not at this time. There hasn't been any progress. We have a couple other high priority things going on at STS with finishing the congenital database and getting the other two longitudinal dashboards launched for general thoracic and congenital. Once we're settled there, then this will be something that our research center will be working on. Oh, there you go. Crystal put in the chat box that you could try. This is for the export of the longitudinal reports, that you could try file export to PDF to get report if the export report button is not working. Thank you, Crystal. Is there any projected date of when the last harvest data will be available? We're waiting to hear back from DCRI with that date. So once DCRI gives us a date, and they deliver on that date, then IQVIA takes a week or two to upload the data to the platform, and then it'll be released. So no, we don't have a date at this time. In regard to not having a sequence number on the abstract, if you have a new abstract with new numbers, wouldn't the trading manual be new and therefore the number would still be matching up? Not sure I understand the logic behind the current state of no number visible on the abstract. I have to say it's very inconvenient. Sarah, and does anybody else know on here, is the short name available on the data collection form? And Sarah, I'm assuming not. Oh, okay, then maybe we could work with you guys on IQVIA on it to see how we can get the short name to be visible.
We do have an enhancement log. STS 3999 is on file to add the sequence number. So that's something that I guess is on the table.
Okay.
But yeah, we do have that.
Mm-hmm. Yeah, and the short name would be good too, because the short names don't change against version. So right. It just gets folks used to using the short names.
But it's something we can look into and discuss.
Thanks, Joe. Could you please speak to whether we will be using MIPS this year? Is this something going away? I would appreciate a verbal update on this, please. Thank you. So as I said, we will not be
Carol,
reporting.
I can take that.
Thanks, Jane. Go ahead.
Sorry, go ahead.
No, go ahead.
Oh,
please.
Sure. We are a QC. We are a qualified clinical data registry, but we will not be submitting MIPS data on consenting surgeons' behalf this year. And to add, STS did not self-nominate for the 2022 reporting year, so we will not be supporting that as well for 2022.
Thank you. Thanks, Jane.
Sure.
Okay. We don't do all of the procedures done in general thoracic, so we usually only attend part of the day. So this year we can't get any credit. Emily, did you want to restate what you had provided earlier?
I guess my restatement would be if you attend all of the adult cardiac session, you will get credit for all of the adult cardiac session.
Thank you. Okay. Thank you, Emily, Amy says. Cindy says, you mentioned shared decision-making. Is there going to be a form to use or in the database, a place to document yes or no to shared decision-making conversation with the patient? So the STS risk calculator is part of the shared decision-making, and that question asks if the surgeon discussed the score with the patient. So that's part of that. We do not have a separate form or a separate checkbox. I think that NCDR has added that into some of their databases, not in the TVT registry at this time, but it is something we are aware of and will look at in the future. Okay, I don't use the risk calculator. Can you please go over how to do it and what fields go in it? I just answered the question, was it discussed? So your surgeon is the one, your surgeon or healthcare provider who is, it might be a PA or an MP who's discussing the patient's procedure and doing the planning. Most definitely it should be the surgeon. They fill out the risk calculator online, which includes all of the risk model variables, and it provides estimated outcomes for the risk. So it would say risk of stroke, 2%, risk of prolonged ventilation, whatever it may be. And then the surgeon needs to document that they discussed those outcomes with the patient.
Cheryl, it might be nice to show the participants where that is.
Yep.
And
Thanks, Melinda. So on the sts.org under resources, the risk calculator is this fourth one here. And then you have to use the short-term, it's the short-term risk calculator. And then you select, you have to accept it. And then you select your procedure that is being performed and you fill in the variables that go into that risk model. And then you will get risks. I don't know if you all can see that or not. You get risks for mortality, renal failure, stroke, prolonged ventilation, deep sternal wound infection, reoperation, morbidity or mortality, short length of stay and long length of stay. And then the surgeon discusses these with the patient, and it should be dictated in their consultation for you. Did you want to add anything, Melinda?
yeah, I just wanted to point out, because I think sometimes I get questions about where that is, so it's just good to review it.
Okay. So sts.org, and then under resources, risk calculator. This gives you some information about it, step-by-step instructions, and then this button will take you to the site where it's at. Okay, thank you. The TVT registry has added, yeah. So if it was added, it was just added. It might have been added when version 3 went live. They do document the discussion in the record. Okay, that's perfect. Then yeah, that's when you can code yes to that field. Will STS allow a hospital to link the calculator into their EMRs? Usually, yeah, Cindy, you are able to put a link into your EHR software. So you could provide a link into your Epic software if you wanted to. Just have to make sure sometimes when if it's an automated calculator, and it's pulling from certain fields in your EHR, you have to make sure that you get the result that was documented prior to surgery. So for example, if you're looking at a isolated CABG patient and you're pulling hematocrit, you want to make sure that the result that is discussed with the patient, that the risk scores discussed with the patient is using the hematocrit that the patient had at the time of the discussion with the surgeon, not the post-op hematocrit or something like that. So you just have to be aware of where you're pulling that from. Regarding the risk calculator, though, there is no metric to put in the number, correct? Just that it has been discussed. Yep, that's correct. Just that it has been discussed with the patient. How does it affect us when the surgeon does not document the risk score discussed with the patient? Well, you just code note if they haven't discussed it with the patient. I don't know that there's any negative outcome for your site, but again, it's part of, discussing the procedure and the risks with the patient prior to the patient going into the operating room. Okay. Uh-oh. So our surgeons document the patient's STS risk score in the H&P and states that the risks are discussed with the patient and lists the risks. Does the verbiage need to say the STS risk score was discussed with the patient? Melinda, I'm going to hand this one over to you because I'm not sure exactly how we've been instructing on that.
Yeah, so there has to be linkage. I mean, so you have to link the risk score and a discussion with the patient or the patient's family. So you said the risk scores in H&P. I would think that the surgeon would need to say that the risk score was discussed with the patient and the family. The STS risk score. There has to be some linkage.
Yeah, what if they say that and then they say say that the surgeon documents that the risks were discussed with the patient, and then how she says list the risks, and then they go on to say that 2% risk of stroke, 2% risk of mortality. They're getting those percentages from the risk calculator, right? I would assume.
Right. Well, it depends how it's written in the H&P too. Sometimes I ask people to send me what it looks like because sometimes they'll have the whole, all of the risk and the score right there in their H&P, and they talk about discussing it with the family. Sometimes you'll see in the H&P or the consult note that it's just a score that they got off the risk score that they did, and that they've discussed this score with the family. So it really, as long as you can prove there's some linkage that yes, that they did do the risk score and they did discuss it with the family, then you can say yes.
Mm-hmm. Yeah, you have it really, really clear here in the training manual too. Thank you, Melinda.
Welcome.
I'm sorry, Crystal, I'm not sure I understand your statement. I have identified 4 cases that had non-analyzed procedures. It's showing missing data that was required for analyzed procedures. Who can I contact? I guess you would want to contact IQVIA, but
Carol, we get this question fairly frequently. It's the fields like esophageal data collected and hiatal hernia data collected. Those ones will come up as errors if they're not answered for non-analyzed cases. And I think the data specifications suggest that those are required for all records.
Yeah, I'm not sure if Crystal's talking about general thoracic or adult cardiac.
Oh, I'm
She's
so dumb.
talking about, that's general thoracic stuff.
Sorry, I had that on the brain because somebody asked that earlier.
Yeah, that's the correct answer. Yes, I need to answer those.
Correct answer. That is relevant to nobody.
Yeah.
Yeah.
So those they need to be answered on all cases for general thoracic, but if you have a question on that, maybe Leanne, would you be able to help Crystal? Okay. Leanne will put her email address in the box for you.
Yep.
Thank you. Our CTSM PPAs will document the risk score was calculated and discussed with the patient family, but the risk score calculations are not in the records. Is that acceptable? Yes, that's okay. STS score needs to be discussed with patient or family, but the scores don't need to be documented.
That's correct.
Good, thank you. Okay. And I see a question in the chat from Janice. Janice, I'll read this, but if in the future, if you could just put it in the Q&A, and that way we don't miss these. What if the MD documents the STS risk score calculator? Oh, and I just answered that. Never mind. It's the same question. If the doctor does not specifically document that the STS risk score is used, he only documents a risk score based on his experience. It does not count, correct?
Correct. He has to reference the STS risk score.
Thank you. You get a lot of those questions, huh?
I get a lot of those questions.
Is it acceptable to have a risk score scanned into the chart and HMP stating surgery risks were discussed with the patient?
As long as Victoria, as long as there's some linkage, you've got that. If that's in the same document, you see the scores and it's been discussed with the patient and family, as long as you can prove the linkage there, it's acceptable.
Thank you. This is good. Thank you, Melinda. I'm not laughing at the question. I think it's funny. Not funny, but I think it's great that I'm kind of like laughing in joy. I think it's great that people want to make sure that they're coding this correctly. So thank you.
You're welcome.
Okay. Anyone else have any questions? We have 15 minutes left. I want to click on this link that I saw in the chat box. Oh, see, Bobby McFerrin released it in 1988. Okay, there you have it. I'm not sure how Bob Marley sang it because I don't know that. I don't know, but I'm gonna have to check into that further and have an answer on our next webinar about how did Bob Marley get that song. How far back do we need to enter data in the COVID fields? That's a great question. So the COVID positive testing field, where it says, did the patient have a positive COVID test? That field was implemented in April of 2020, and we asked sites to start collecting that April 1st of 2020, but they could go back further if they had positive patients. The date field was implemented in May 1st of 2020, so you can start entering the date of that positive COVID test in May. You could go back further if you want, but we asked sites to do it in May, so we didn't ask sites to retroactively code anything. Hope that helps, Paula. Yeah, right. Brooke says it's a common myth according to Google. Bob Marley dies before the song was written, I believe. Yep, it's so confusing. Google just ruined my whole trust in them by having that on there. I'm not sure if this is correct. I'm not sure if this is correct meeting for this question. Can you go over how to run missingness reports for the NQF? Let me see if I can find where my thing went here. That's not it. Hold on. I think I can help you. There we go. Okay. So I'm going to go back over. I'm going to select a different site that I have access to here, and I'm going to show you the missingness report. So I'm on the IQVIA platform under adult cardiac, under operational reports. You select this, and then there's a missing variable report here. I'm just going to select a small time window. I just did January of this year. And so all missing variables, this will show you all the variables that you have missingness on. There's a filter here on the left for risk adjustment models and national quality form and PROC ID. Joe just said that they're reviewing, IQVIA is reviewing the variables that are applied in this national quality form, that some of the variables might not be represented. So I just suggest using the all button. And remember, we talked about this a couple months ago, that you can filter on this by clicking the first clicking the first row here and clicking this up arrow, it'll put it in alphabetical order, which makes it a lot easier for you to go through and just see if there's anything that's really like date of birth. This site doesn't select date of birth, so that's acceptable. I'm expecting to see 100%. Other things that I might be looking for that are missing, I'm missing one of these cases where cooling time prior to circ arrest was expected. I'm probably going to go back and double check. Oops. Sorry, the scrolly thing is getting crazy. This one, I'm probably going to go back and double check to make sure, you can click on this and it'll open the chart for you. It'll provide you a case list. I'm probably going to go back and double check that my cooling time really wasn't available. And probably some of these other ones. So I would just go scroll through this whole missing variable chart and double check. And then I'm also going to check my risk models because thankfully I don't have anything that's missing here. But the risk model, risk adjustment models, these are the variables that go into the risk models that assess that you provide your expected outcomes. So as we talked about before, you have your observed outcomes, which are your actual outcomes. And then you have your expected outcomes, which are calculated off of looking at all of the risk that the patient goes into the OR with using the risk models. So you want to make sure that you document all your risk model variables to give your site all the credit it can get for those cases, especially the really high risk cases. You want to make sure you have everything documented. And then PROC ID breaks it down, I'm assuming, by the various PROC IDs or the variables that go into determining PROC IDs. But the two that I would probably look at the most are the all and then the risk adjusted models. The risk adjusted model missing report is going to be a subset of this all. But I would just want to make sure I didn't accidentally miss any risk model variables when I did my scrolly through here. So I hope that helps. If the actual STS score is in the medical record and the patient expires, could that be used against the surgeon? I'm not sure what you mean by that, Michelle, but I'm not sure what you mean by that. If you could provide some clarification, be happy to try to answer. Our software Qcentrix does not have a COVID question. Will we be docked? So Cheryl, it should be in your Qcentrix software. It's actually one of the temporary fields. So you might have to look for a temp. Let me see if I can find it for you.
Like 7230, isn't it? 7230.
I think that sounds right. Yeah, let's double check. You'll see here on the data collection form. I'm looking at the annotated data collection form. The COVID fields are here. Yes, so 7230 and it's temp code and temp DT are the two fields. So they should be available in Qcentrix. You might just have to look for them underneath the section that has the temporary fields listed. If you don't see them, reach out to Qcentrix so they can help you out with that. And it will be audited. So it's really important that those fields are collected at your site. Especially if you're audited. Will STS stop removing patients with pre-op COVID like 4 months before surgery for risk-adjusted cases? So we are in a discussion right now with STS surgeon leadership and to discuss adding a time frame onto those positive patients. Right now we don't have any changes in place, but we are in discussion with them and more information should be coming in the next month or so on that. Stay tuned and I will update everybody. Okay.
I'll take this next one.
Yeah, this is from Barb. I sent a question about convergent approaches via the STS site after the last call. I have not heard anything at all yet. My security department says all STS emails are being forwarded through our quarantine. Should I resubmit it?
Well, I did answer her question as I'm looking at it right now. I remembered her question. And so it sounds like they're being quarantined on her end. My emails are. So
Barb, maybe you might want to whitelist the sts.org.
Yeah, whitelist us. And if that, I'll try to resend this to you. Or maybe do you have another email I can send you the answer to? That would be easier to get through.
Yeah. Thanks, Melinda. And I put the whitelist sts.org, and another email might be helpful. Even if the patient doesn't have a confirmed COVID diagnosis and it's marked no, we are prompted to answer the date of the COVID test, and it's coming as a missing field for us. And so there's no parent-child relationship built in between the temporary fields that we're utilizing to collect this data. So you are going to be prompted to provide a positive COVID date. It's okay to leave it blank. If they did not have a positive COVID test. Michelle is clarifying her question earlier. The STS score is low, the patient expires, the family sues and requests full chart. So I think you have to talk about that internally with your risk department and with your legal team to discuss about that. I can't really provide any guidance on that, Michelle, I'm sorry. I am a new data manager and am figuring things out. Am I able to go back and update submissions if I find that I missed items? Yep. You sure can go back and update your data. Just make sure when you update it in your vendor software that you also submit a new file to IQVIA that includes the dates of records that had updated data, that updates were made to the data for. We have a new data manager webinar tomorrow at 2 p.m. Central. So it's also a great place to if you're able to join, please join, and we'll be able to talk more about that. It's interesting that there are a lot of questions about the STS calculator. Our doctors haven't used it in the past, but now dictation is showing up in their H&P that they are using it and discussing it with the patient. Has there been more focus on it from STS to providers? I'm not really sure what, I'm not really in the education for the surgeons, but it is likely that maybe one of your surgeons noticed that they aren't dictating it and they wanted to include it in their H&Ps, which is totally fine. And I think that that's good. Could also have to do with maybe your hospital is looking also at shared decision-making and trying to ensure that the patient is fully informed of their procedure and the risks associated with it. And one way to do that is to use the STS risk calculator. When will we start receiving email notifications when risk-adjusted harvest reports become available in IQVIA? With the next harvest report that comes out, I will be sending emails out that those reports are available. I'm not quite sure how I'm going to do that yet, but I will do it. Okay. Will the date, sure do have a lot of questions today. Will the date ranges for the 3-year cabbage composite be listed somewhere? Jane Hahn? It's all right.
Sorry, I was double muted. Yes, the date ranges will be the same as the valve and valve plus cabbage composite measures and will be provided in the risk adjusted report.
Thank you, Jane. And also the STS risk score is included in the audit as well. Yes, we do audit that field. So thank you. Thanks, Glaze. Okay. Oh, and what about the numerator? Oh, I'm not sure your question, Natalia. Are you talking about the 3-year cabbage composite? It's going to be reported out the same. It's just going to be a longer time period. Let's see here. I don't think we're reporting out the numerator and denominator right now. We are providing the case counts under the benchmarked reports. And I think we are talking about including the numerator and denominators because I don't think those are provided out right now. Yeah. So there's that. I think we're talking about if we're going to add that in or not. Right, the benchmark counts don't always get included in the risk adjusted reports. we'll have to talk more about that because I have to think more about that because it should be the same. If we're looking at isolated cabbages here, we're using the PROC ID to determine these isolated cabbages. Should be the same as determining the population for these isolated cabbages. Well, I'll have to look more into that and see what the difference is. Okay, and you're welcome. Uh-oh. What happened? One of the questions went away.
Jane's responding to that one, Carol.
Oh,
I
thank you.
responded to it. Sorry, Carol.
Okay, thanks. No, that's okay. I was like, uh-oh, what did I hit? All right, I guess we're at time. That was pretty good. I wasn't expecting to get so many questions today. I'm glad that we did. Okay, so we're all done. Thanks everybody for joining. Oh, hold on, one more. Do you think the U.S. News World Report is using the same definitions for cabbage and ABR and outcomes? You will have to look. U.S. News and World Report includes information on how they determine their populations, either on the U.S. News and World Report website or somewhere within the reports that come out. I was able to find it before when I was looking for something else. So you're probably going to want to check with them to see how they determine what their populations are that they're reporting on. Thank you, Tricia. Thanks everybody for joining. I hope you have a great rest of the day, and we will see you all tomorrow at 2:00 Central Time for the new data managers webinar. And please take care and stay safe. Talk to you all later. Thank you. Thanks everybody. Bye.